for those of you who haven't looked at the pictures, I mean, monkeypox is another virus. It's an orthovirus, but it is spread by skin contact, sexual contact, respiratory droplets, so just coughing and sneezing, and then surfaces that can become contaminated can be a way of spread. So, you know, you can imagine like if you were in a home with somebody that had it and they touched the countertops all over everywhere, you could actually pick it up from that. Direct skin to skin contact is the most important, but the others are not nothing. And so go ahead, Ericka.
Agreed. No, I agree with you. You need to pay attention to all those.
Yeah.
Agreed.
Usually after you come in contact with someone that has the disease, you are asymptomatic for about 7 to 14 days. And then you sort of get a flu-like symptom with fever, fatigue, sore throats. And then later develop a rash. So the rash usually starts as just a small little bump, kind of, and then it hurts. Often they hurt. I've heard quite a bit. And then it turns a little bit red and swollen, looks a little like a blister, maybe looks like it has a little belly button in the middle of the blister. They can be on your mouth, they can be on your arms or on your hand. Most commonly right now, we're seeing them in people's mouths, inside their mouth or on their lips or on their genital area or their rectum, because most of the contact has occurred when people are having intimate relations. But it can also be present on skin, on the legs, on the arms. And then you'll notice some swollen nodes, and you're infectious from the moment you really begin to be sick with just feeling that yucky feeling and fever. And then the infectious period is, you know, we thought having to isolate for 10 days for COVID was bad, but monkeypox, you're infectious until all of those skin lesions actually heal and you have intact skin. And that can be 3 to 4 weeks. So it's not really something we want to see people getting. It's just kind of miserable and it's uncomfortable. And we don't really have widely available treatment for it right now. If you are somebody who is very high risk, you have lesions around your eyes, or you are unable to eat because you have so many lesions in your mouth, or you are somebody who's really immunocompromised, like you're on chemotherapy, or you're a transplant patient, or you have poorly controlled HIV with a really low CD4 count. For those people, there is a medication called Monkeypox that we can sometimes get access to. It requires that we apply to the CDC to get the medication. But most hospitals have somebody on, well, I should say, I know Frederick and Aurora at St. Luke's are able to get that medication now for cases that are severe and meet those criterion. But it's not available just because you have a boo-boo and you want to feel better faster. It's only, we have limited amounts of it, so it's only available for people who are very seriously ill with the monkeypox. There are some other new treatments coming down the road. And then I'm going to hand this back to Ericka, because an important thing is we do have vaccines. We have 2 vaccines, and they are very helpful. We are still waiting to see just exactly how helpful they'll be, because they've never really been tested in large populations, because they were originally developed to treat smallpox. And for ethical reasons, we don't do trials with smallpox. That would be really dangerous. But we know from human trials of people taking the medication that there were no major safety side effects reported when they took it when they were healthy. And we know that it worked in animal models, and in some limited trials of monkeypox, we know that these vaccines have been helpful. So the vaccines are helpful if you've not had any exposure at all. That's really when you want to take it. But if you have had a very recent exposure and you can get a vaccine within 14 days of your exposure, it may decrease your risk of becoming infected, or if you do become infected, it may decrease the severity of your infection. So if you are somebody who's having multiple sexual partners, if you are a man who has sex with men, or you are have friends who've had monkeypox, you are people who should be signing up for Ericka's vaccines. At some point, we may broaden those categories, but right now we're really focusing on the highest risk persons. And those are the communities where we're seeing a lot of transmission. And when I say a lot, you know, we first identified cases of monkeypox in the United States in late May, like 2. And we are now up to over 7,000 cases nationwide. And Illinois, Chicago area has a substantial outbreak going on, as does New York, Texas, and Florida, and California have really big outbreaks. And the 2 cases I've seen were young adults who went into a party in Chicago and came back not so well. So take it away, Ericka.
And that's a really good point. Our proximity to Chicago, because the people, a lot of people that I am working with, they travel back and forth. School's about to come back into play as far as college, you know, is concerned. So people are starting to move back into dorms, and you know, a lot of people that are not necessarily in your current pod kind of thing is happening. There's a lot of that movement right now. And so as I'm talking to the people that came to get vaccinated from us last week, some of them, the one that I know I heard drove the furthest was like an hour and a half away. So some of these rural areas around us, especially in Wisconsin, they don't have access to vaccine. So we are very fortunate to have it. We're making it as widely available as possible to, like you said, the populations that are most impacted. But really, even the people that, there was an older lady that came in and people were like, what is she doing here? And it turned out that she was a contact to a case, and that person who had it lives in her home. So she came because of that, and that was appropriate, as Donna had mentioned. And but she also was very concerned about like all the things, like, well, how do I really keep myself safe? I'm older. I really, you know, having these kind of conditions be a part of my environment is not really good for me. And so what can I do? And so really having being able to have a conversation with her about what kind of things she can do to protect herself, it gave her a lot of peace of mind, because she was able to actually ask her questions and get an actual answer, which is not always the case. There's a lot of people I know, again, around the community a lot. So there's a lot of questions around monkeypox, but not a lot of platforms by which people can actually come and get those questions asked and answered in real time. So we hope to, Health Connections hopes to create an opportunity like that in the next few weeks or so. We've been talking to providers. Hopefully Donna can be a part of that conversation as well, to see if we can get providers and other people in the community to be a part of the conversation, so that we can make sure that people have the information that they need to know what they should do as far as trying to take care of themselves, and how we can do this together. But also we want to be very clear and careful about not stigmatizing people who are of these different populations and pigeonholing them as if they are the only ones at risk. So we just want to be very careful and clear about that.
Another thing that I would just stress is, if you are coming in to be tested for monkeypox, it is helpful to notify the provider ahead of time if you are concerned about monkeypox, because it does allow us to take some special precautions that make it easier for us to handle dealing with your case appropriately. Cases that come in, we like to bring them, just like we did with COVID, directly to an exam room, and the providers generally will want to wear personal protective equipment. Otherwise, then the providers have to go out on isolation potentially. And so that is one nice thing you can do if you think you have been exposed and you now have a fever, or you have a really tender sore that you want someone to look at. Kind of just give a little holler before you come in and let us know that we're going to be looking at that. So.
And Donna, correct me if I'm wrong, and you might have mentioned this, the only way you can actually get tested is if you had an actual lesion, and that lesion gets swabbed and sent to a lab. Is that correct?
Yes, that is totally correct.
And so that's because we've gotten a lot of questions about that. People thinking that I may have been exposed to someone. How can I know for sure if I have it? And I'm like, I hate to say this, but you have to wait till you actually get a lesion in order to get diagnosed for, and confirmed, which doesn't, it doesn't feel good to be told that, you want to, people want to get, blood drawn or, swab, so, like they want to know now. And we want you to know as soon as you can, but at this point, as soon as you can is when you actually have a lesion as Donna described, in order to be able to even be eligible to get tested, and that's a real thing.